Hello, my name is Sydni Williams. I'm a Black woman from Detroit, Michigan. I am a medical student and a Master's of Science in Clinical Research candidate at Emory University School of Medicine, and together we elevate med. So for much of my life, my dad and my brother too struggled with largely undiagnosed mental illness. And around the time when I was around 17 years old, I remember that the symptoms of my dad's mental illness just became largely undeniable. He had this heightened euphoria, days where he'd be on top of the world, and other days where he'd be hopeless and he didn't move. And he was not who I remembered him to be. But by the time he interacted with the healthcare system and got a diagnosis, he had already equated therapy and treatment with weakness and too afraid to seek help and too worried about what people would think about if he did, he unfortunately turned to recreational drugs to cope with the pain. And in 2018, my dad unfortunately lost his life to an overdose. And I couldn't understand why he was so resistant to treatment. And it wasn't until after his death that I realized how could he feel comfortable seeking care in a system where only 4% of physicians are Black. I now understand just how difficult that process was for him. I realized that I had to become a physician. I realized that without doctors like me who look like the patients that we serve and represent the communities that we serve in other ways, culturally, spiritually, I realized that so many people from marginalized communities would continue to suffer in silence. I am planning to apply to emergency medicine next year, and there are several reasons why I've decided on that specialty. Kind of the most obvious reason is because I love a fast-paced environment, love the opportunity to think on my feet and to have evolving patient care plans that are changing with incoming information. That just excites me and invigorates me to know that it's going to be something different than it was yesterday. But outside of that, many of the patients that I seek to advocate for, patients of marginalized identities, many of them come to the emergency department to get their care, unfortunately. And sometimes it's their first interface with the health system, or sometimes it's the place where where they most frequently go to get their health care. And that makes it a really unique place for me to make an impact. And I'm excited to be a physician that works in the ED, that is known to be an advocate and ally for people. Fit others the most is my determination, perseverance, and my resilience. I am a person who, when I believe in something, I have to see it through and I have to see it made right. And that those attributes allow me to be an advocate outside of the hospital as well. They allow me to advocate through roles such as working with the AMA or being a direct patient support chair for Atlanta hotspotting, or working with the leadership in my county to get racism as public health declared as a national or as a countywide crisis, and building a task force. I mean, the list goes on, but I think that just being resilient and being able to continue to fight for what you believe in is a strength that will benefit my patients for years to come. I'm adamant about leveraging the power of representation, and I think that my purpose in medicine is to elevate the voices and experiences of those who have long been silenced. And I find a lot of passion in diversifying this space and about understanding the needs of diverse communities and advocating for those needs. And I think that's what ElevateMeD is all about. I feel really affirmed as I've been to previous ElevateMeD events and heard them speak with passion about the scholars that they support and about the mentorship and the networks that ElevateMeD has created. I feel so confident that this is a place that will breed me to be a leader of my community. I first just say thank you and extend my heartfelt gratitude for your commitment to scholars like myself and to advancing diversity, equity, inclusion within medicine. I think this is excellent work that you're doing, and I'm so glad that we have supporters like you to help us on our journey. I want to affirm you in your commitment and say that your investment into ElevateMeD, into scholars like me, not only transforms lives, but it's transforming the field of healthcare. And it's working in people like you and the work that you're doing that are helping to build a more inclusive and equitable healthcare system. And so I just thank you for your belief in young scholars like me that are going to join you on this fight.